Hi, Mateo. Good evening.
Hi, teacher. Good evening.
How are you?
Hi, fine. Thank you.
Okay. Mateo, do you remember we were talking about psychiatric diseases or conditions, maybe?
Yeah.
Okay. Can you describe any case you experienced, maybe in your consultation?
During my psychiatry rotations, I experienced. We were in the psychiatry area in the Hospital de
Mhm.
Clínicas. That was my worst rotation ever.
Okay.
There was a woman with schizophrenia, and she didn't knew who she was, and she was so bad mentally that the her hygiene was horrible. Like you, she smelled like urine everywhere. So, and the worst part is that that patient uh, thought that I was her husband, that I was her Nigerian husband,
No.
and that we have three
No.
kids. Yeah. So yeah, I'm Nigerian now. Oh, that was
Yeah.
horrible. That was horrible. That woman um all used to follow me everywhere. She used to tell me, you can do with me whatever you want. I'm alone at night, and that night was not like, no, please, someone take me out of here. It was horrible, the worst experience. So
And
basically,
you didn't have the chance to change
it
to
was not my
other.
patient.
Sorry.
It was not my patient. You're freeze. Ah, now I can see.
Yes, I.
Still there?
Okay, can you listen to me better?
Now better. Yeah.
Okay. Okay, let's continue. So you didn't have the chance to go to another or with another patient?
It was not my patient. We during our our psychiatry practices, we had to stay
Mhm.
there like between 5 to 7 hours a day during
Uh-huh.
2 weeks, and that place is like I don't know, like it's a place where all the patients are walking and talking to everyone. Some patients are attached to a chair, and
Mhm.
it's more, it's like those movies when the patients
Yeah.
are are everywhere and are like watching the sky and dealing with its own mind. Uh,
Wow.
that's what it like. That's what it's like. So I haven't had the chance to avoid that woman, but my 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 classmates, helped
Mhm.
me with like hiding me somewhere, some way. It kind of worked, but eventually the woman uh, find me and and started talking to me, and horrible. Yeah.
Oh, no, I can imagine. And you didn't have the chance either to tell her maybe go away or something like that, because I don't know if she become angry or something.
Yeah, she may turn violent or angry and start screaming and tell, "I am
Mhm.
Jesus" everywhere. Like she was really bad. She was really, really, really bad. That's a kind
Poor woman.
of schizophrenia. That's the worst kind of schizophrenia. Like there's constant state of delusion and having hallucinations of every kind, and you can perceive yourself as a superior entity, and it's dangerous. You don't know what the patient uh, may do in the next 20-30 seconds.
Oh, she wasn't taking medication.
She was taking medications.
Oh wait.
She was uh, admitted, so she was under a strict regimen of medications, but apparently that
Oh,
wasn't enough.
yeah, she has that behavior even though she was taking the medication.
Yeah,
So poor woman.
yeah,
Okay.
yeah. There are a lot of people that are like in similar conditions or not another,
Mhm.
but the the ones that are admitted to the service are not well to enough to live there by themselves.
Oh, poor people.
Yeah, yeah, it's so sad.
Yeah, and how about you and your classmates? Maybe you were traumatized or something.
I was counting the minutes to get out of that rotation. It was the
Mhm.
worst experience of my career.
Stressing.
Yeah, I didn't like the the, the kind of relations that you have with the patients. You know, and I don't I am not um, patient enough to dealing with that kind of personalities.
Okay, I understand. Poor Mateo. Oh no. Okay, let's
Yeah.
change the topic then.
Okay.
Mm, can you choose any condition and explain as if you were telling to your patient, maybe taking into consideration the steps or the protocol that we were talking about yesterday?
How I don't get what you want me to do.
To choose any condition you want, and maybe
Okay.
you can explain to your patient what is going on with him.
Okay. So maybe breast cancer, uh, and I will explain the woman that uh, if there is if the woman found and in the physical examination we found a small mass in the breast, we can
Mhm.
we can tell the patient that okay, uh, this is probably a malignant tumor, um, but don't you worry, it is small. We have to make more uh, analysis to determine the type of the tumor and start with the appropriate treatment. And if the treatment is followed up regularly and appropriately, there's a high chance you to recover completely. Breast cancer nowadays is not like 60 years ago. Now women have a great chance of survival and recover their past life independence and quality of life.
Okay. Can you repeat the last part, please, Mateo?
Okay, so breast cancer is not nowadays, having a breast cancer nowadays is not like 60 or 50 years ago. Nowadays, women have more chances to recover to fully recover and have a good quality of life.
Okay, perfect. And the last thing, maybe you missed asking some questions like, do you have any doubts or something like that?
Okay, yeah. Oh, yeah. That's correct. So I will ask the patient if she has any doubts about the condition or the treatment, and the times we have to begin with the treatment.
Okay, perfect. And the last thing now, choose between diabetes, depression, or a gynecologic patient to do the same exercises using lay terms.
Using what?
Using lay terms. Remember?
I don't remember specifically what was late terms.
Lay terms
Was...
is an easy way to explain your patients
Okay. Okay.
in
Yeah.
words they can understand.
No, I remember now. Thank you.
All right.
So I will choose a diabetic patient, and I will explain to the patient that this is a condition where the blood sugar levels are high, are over the normal values, and this elevated blood sugar level can cause some problems in the eyes, in the feet, in the skin, and sometimes or regularly the patients start to voiding more often, to lose weight, to have more of hunger, and this condition has to be managed with long-term treatment and diet changes that will help the blood sugar levels to lower and improve the whole health state of the patient, and prevent those complications like wounds in the feet or losing of vision. Pretty much it.
Okay. Okay, Mateo, that was good. Thank you so much. And I will
Thank
send
you,
to
teacher.
you my card, please.
Okay.
If you can see it, I don't know.
Yeah, I can.
My internet is so bad. I don't know what is going on. Okay.
Yeah.
Just take a picture. Just 1 second. One more, and I'll let you go. And
Okay.
see you tomorrow.
Yeah.
Okay.
Tomorrow at the theoretical class.
Yes.
And Thursday at the same time than now.
That's right. Thank you so much, Mateo. Take care. Have
Thank
a
you,
great
teacher.
night.
Have a good night too. Bye.
Bye. Hi, Jorge. Good evening. Hello? Hi. Okay, Jorge, can you listen to me now? Hi, Jorge. Good evening. Hello?
Hi, good evening. Can you hear me?
Yes, now I
I'm
can
sorry.
hear you.
Yeah, my computer is like, I don't know what's happened.
No worries. I turned off my camera too because my connection is a little bit bad, okay?
Okay, no problem.
Okay, Jorge. Mm, I really would like to know if you have any experience with psychiatric cases in
Well,
your
yes.
rotation or
Well, actually, there were a
okay,
lot
go
of
ahead.
experiences. It was, it was, I could say a different experience. I couldn't say it was bad or good, but it was different because we were always used to see all kind of illnesses from, I don't know, from the first year of med school.
Mhm.
But when we rotated psychiatry, it was like something really brand new for us. And we also had to do like a kind of words. Let's not say words yet. It was because like we stayed from, for example, I don't know, 11 a.m. to 5 p.m. watching the patient, um, taking all the notes we had to take regarding, I don't know, we had, for example, we had assigned a patient for each one, so we had to do the clinical history and all that stuff. And of course they are like really different people from what we were used to work with. And yes, I remember I used to rotate with Mateo too, because he was my classmate. And I remember there was a patient who thought Mateo was his brother. He
Yeah.
was really convinced about it. I don't know if he told you that story.
Oh my God, he already told me that he has a, no, I don't know if she was his patient, but she thought that he was her husband, her
Oh yeah,
Nigerian
there was another one too.
husband.
Yeah,
Oh no, poor Mateo, he was so
yeah, he was
convinced
like the
that
target, the patient's
yes,
target.
the worst rotation of my life, he told me.
Yes, yes, yes. It was awful for him because also his professor was, I think, was the hardest one because she was tough.
Oh,
The doctor, yeah, the doctor was tough for I think for all his classmates, and scores were not that good regarding that professor. But yes, I saw a lot of patients. I remember also one that was, I think it was my first week rotating psychiatry, and I've been sent to take the clinical history to that patient.
mhm,
Um, but it was a misunderstanding because I wasn't allowed to take the clinical history of that patient because he was a dangerous patient, and as I was a student, I
mhm.
wasn't allowed to do that. But the residents uh, were not that sure, and they sent me. And after that, I was like, it was a dangerous patient because I think he had schizophrenia,
Okay.
and he was very aggressive. And it's totally different to make a clinical history of a psychiatric patient, because there are a lot of things you have to write down, totally different from a non psychiatric patient. So my professor told me that I was not allowed, and he was mad at the residents because they sent me with that patient. But I don't know, it wasn't that like that dangerous because the patient was tied to the bed, so he wasn't able to damage anyone. Anyways, he was like really dangerous and aggressive. I also remember another patient who had schizophrenia too, and that patient, I remember he used to tell us that him and he saw like demons everywhere, and he was under treatment, of course. And after that, I also remember another patient who was admitted like that day. We were doing the morning rounds with the residents and the professors, and I don't know why, but someone released the patient that was tied on the bed. And the patient just got up from the bed, took out a T-shirt, and he put down on his knees and start praying. It was really strange. It was really a different experience.
Yeah.
Um, you know, what I can tell about that rotation is that like the environment was a kind of heavy, let's say, because all the patients were like um, critical patients. Not any kind of patient was there. So it was a heavy environment, and staying afternoon later was awful because like what do you do with that with those patients? This is kind of hard to explain. Of course,
Yeah.
you try to have a conversation, but it's not always easy to have a conversation with them. But we have fun days too, because on Fridays, when we had the ward on Friday, we used to play soccer. We used to play soccer with them, and that was like releasing for their anxiety, releasing for their stress, and it was a nice experience because all the guys, the classmates, the students that were rotating in psychiatry used to play with those patients, and it was nice.
It was nice, except for Mateo.
Yeah, except for Mateo. Yeah, he was a goalkeeper always. Yeah,
Poor Mateo. I can
yeah,
imagine. And he told me I'm not that kind of, I don't have that patient or patience, sorry, with the patients. And it was so, I know him. He's serious, and I just could imagine
yeah,
how was his behavior.
yeah.
Okay.
His behavior is like he really like he's really calm. He's really quiet, and he was like that with the patients.
Yeah, poor Mateo.
Yeah.
Okay. Changing topics, maybe you can choose any condition you want and explain as if you were explaining to your patient, please.
Okay. Um. Oh, I don't know. Well, based on late experience,
Mhm.
um, I saw last Saturday a patient with gynecomastia,
Okay, what is that?
and okay, this condition is
Mhm.
due to downregulation, let's say, of
Mhm.
testosterone. Testosterone is a hormone, specifically a male hormone that regulates all male characters, let's say, in the body, and characteristics, actually, not characters. And this was a patient, 18-year-old patient, and this patient goes to the he does a body workout really frequently, and I thought he was using steroids, and that was the reason he had gynecomastia. So I explained to him that steroids are like hormone regulators, that they're not natural on our bodies if um, they're like they're taken as a supplement, a supplementation. So
Well,
I told him that he should stop doing that, and yeah, because it has long term like bad regulation of hormones in the body, and it also has a lot of things that affect our bodies. I took the patient and told him that he just have to uh, have he actually must have a great nutrition. Um, he can take some supplements, as maybe creatine or I don't know, protein, whey protein, but not
mhm,
any 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 kind of hormonal treatment, because that's not good. And I asked for some lab tests, testosterone. I also checked the thyroid hormones just in case, and I also asked for estradiol and told him to come back with the results.
mhm.
And yeah, actually, I think that was all.
Okay. Okay, Jorge, thank you. And just a question here. I was
Mhm.
thinking about that patient I told you last week,
Sure.
and I don't know eh, w- when exactly you noticed that it's not an epilepsy patient, and maybe he's suffering from another condition like schizophrenia, for example.
Okay. So, what a neurologist or general doctor should ask for, first of all, is electroencephalogram,
Okay.
because that's really important. So you can see the waves; they're like abnormal waves. Um, Also, the clinic history, the family history is really important.
Mhm.
The patient history, if he had these kind of attacks before. We also, you told me that he screamed, like he screamed, right?
Yeah.
He was like,
He was fighting with someone. That's why it was so weird for me.
mhm.
He was not shaking at all, but he was fighting and maybe
Maybe it,
having a delusion. I don't know.
yeah, it might also be a panic attack. That's also important to see regarding the how the family treats him. He was a child, right? He told me he was like, how old was he?
Maybe 65 years old, maybe.
Oh, he was elder, right? I can't hear you.
And you listen to me?
I think your connection is something is blurry.
Now, can you listen to me?
Yes, right now, yes.
Okay, sorry. It was like 65 or 70 years old.
Oh, he was elder then. I thought he was a child. So
No.
yeah, I think that in this case, so we might
Mhm.
like focus this like dementia. I think, and that might be dementia, because yeah, I thought it was a child, so that was I was thinking that it might be epilepsy. So I don't think it might be epilepsy due to the age and that. Maybe we can think about dementia or a panic attack. Those would be
Yeah,
the
could
two best
it seems
options.
to be, yeah, it seems to be like a panic attack, maybe, but I don't know. They told me that he had epilepsy, but I don't know. I was thinking that he has another thing. And of course, I tried to calm down because
Mhm.
everybody was scared, and I was, please breathe deeply and calm and everything. He recovers, but I never saw him shaking or something like that.
Yeah,
That's
so
why I
I
was
would,
asking you.
yeah, I would think that that would be like like dementia or something like that, maybe a panic attack. And you did good because it is science proof that breathing like deeply 5 times releases serotonin and dopamine, and that helps a lot of any kind of patient with any kind of panic attack or stress status.
Okay, that's good to know. Thank you, Jorge. I don't know
Oh,
if
you're
you
welcome.
can see my
Oh, yes.
question.
I don't know, but my computer is really slow right now, so it's like charging.
No worries.
Can you
Okay.
confirm me when it's sent? Because I think I sent it,
Yeah.
but it's like the page is still loading.
Yeah, maybe if I send you again.
Oh, give me 2 seconds.
Okay, I already did it. I'm sorry.
Oh, no problem, no problem. Yeah, everything's stuck.
Oh, but I will do something here. Maybe I'm taking a picture, okay?
Okay,
And I will send to you, and maybe you can make an edition like the last time
okay,
and send it back, okay?
perfect. Thank you. I can even leave the meeting.
Okay.
My computer is like
Oh
crazy.
no.
Yeah.
Thank you so much, Jorge. Yes, I think
Thank you.
it's the connection.
Yeah, no, actually, my
Maybe
computer is
something is
sometimes
happening
gets crazy.
with the internet today.
Okay, I'm
Okay.
gonna say bye just if I leave. So thank you. See you tomorrow, right?
Thank you. Okay, hello.
Hello, teacher.
Hi, Rina. Now, can you listen to me?
Yes, a little. I have to connect in the cell phone.
Oh no, everybody
Yeah.
has trouble with their cell phone or with the connection today, but let's be patient, okay?
Okay.
Okay, Rina. Maybe you have any experience with psychiatric patients? You
Yes,
can
a
tell me
little.
about that. Okay, please let me
Okay.
know.
Well, with the kind of patient when I was a student, I went at the hospital at the Psychiatric National Hospital in El Salvador, and it's this kind of patient, it's another world. That the all the disease or all the illness that the person suffer, it's for me it are very complex. For example, the common illness that in the psychiatric attend is the depressed, and it the kind of depressed severe, very very complex, because the stress is when in a normal situation the stress is not a illness, but in the inside inside the person, if the person suffer all the time a level of stress, toxic or very, very strong, in that moment turn a illness. So it's for that reason, I don't know if for this society or all the world, that the person suffer a lot of stress, and after the stress involve or progress in a depressed and anxious, and that is the illness more common in that hospital. That kind of person, when that suffer depressed or anxious, in a first level, it's recommended to be attended for two persons, two specialists. The
Okay, two
psychiatrist,
people.
two people, the psychiatric and the psychology. Because the psychiatric it's a doctor, but it's have different techniques of treatment, like more a treatment in the clinic area. And the psychologist is more treatment about the mind, the activities, or another kind of activities that that contribute a good prognosis for the kind of the people. So the people don't. It's not good for the patient only has a treatment based on drugs. It's not good. It's a better prognosis if the person has a treatment mixed in a part of drugs, obviously, but control, and another part has activities, there is a word, I don't know if you heard about the mindfulness. That is a kind of technique that that is a kind of technique that the psychologists teach of these peers of these patients. That is the less the less of all the disease that the psychiatric attend. The another common is the schizophrenia. Schizophrenia, the schizophrenia, more especially for the people who suffer some trauma in the past, violent, for example, the person who work in a war or who suffer the negative things in the war. That kind of person are susceptible to suffer schizophrenia.
Sensible.
I'm sorry?
Sensible to suffer.
Sensible to suffer, yeah. Another kind of person that I can attend with schizophrenia is the person who take a lot in the past drugs, anxiolytics, opioids, marijuana, heroin, that kind of drugs, very, very, very chronic. That person suffer schizophrenia, but a different kind, because schizophrenia, there are different kinds of the inside the illness. Another person, especially that kind of person, it was a senior, around 60 years old, who suffer schizophrenia, but schizophrenia pura, that is the name. The kind of person, when you talk with them, you enjoy it, because the person have a vocabulary very formal, and the person knows a lot because in the past he was studying at the university, has a career, but I don't know why. I don't know what kind. but
Mhm.
in a moment, in a lapsus, that person start to talk about the ET, the person of the the person who lives out this country, or the problem that has the listen voices, and that voices sometimes speak bad for him. I don't know, in a kind of an idea, very strange. But it is a part of schizophrenia. Yes, I think that is, and this person told me that has a chip on the brain, and the person who lives in another planet talked with them. That is traduce the voices that that can hear in that moment. But it's very what not real. It's a very special to treat that kind of person, because you have to try to understand, but the only the enough for have the ability to connect with with these people. Because the another way, if you have if you express that person has a disease, that has a mental illness, the person, you will lose that person, and the person doesn't take the treatment. That is, I think, that is the different disease that I can watch in that moment.
Wow, a lot of experiences, Rina, and such
Yeah,
interesting experiences.
it was very interesting.
Okay, thank you so much. And now, can you choose any condition you want? It can be psychiatric or another one to explain, maybe a little fast, about using late terms.
Okay, I'm
Remember
sorry. The last part I can hear you. The use it
the
what?
late terms, using late terms.
Okay, okay. I try to remember the terms.
But I can tell
Um,
you, diagnose, then we talk about the management, then we were trying to give a general advice, the prognosis, and final questions.
okay, okay. Diagnosis. Okay. I think. Well. For example, what? Okay, asthma. For a person who suffer asthma, I have to tell about the diagnosis. Let me see. Well, I have to explain about the asthma. For example, we have the result of the spirometry, and we have the result of the blood test, and we find you according with the age and about your different activities, and because you have a problem with the breath, that we see that your bronchus has a little constriction, and for that reason, the air when you breathe in, and especially when you breathe out, the air is difficult to out from the bronchus. So that part of your airway of the respiratory system, that is a little problem, and for that reason, you suffer cough, and you have a little difficult to breathe, especially when you have exposed some allergens, uh,
Mhm.
like cold, or the change of the weather. And for that reason, I recommend follow I recommend be careful about the rain, about the cold, and your activities. If you practice a sport or something, I have recommended to relax while the treatment beginning. And the next control or the next time you come, we analyze the possibility to start some activity, but less, a little less, an activity soft. Yes,
Okay.
start a little by little, because in activity strong, probably maybe increase the problem, the asthma. For the treatment, you have to take using this dispositive who permitted you breathe in a lot of the drug. The drug is in a spray, in aerosol. There are two. You have to use that according with the prescription. And another part of the treatment is I recommend you that I told you. It's a very, or we have hope, we have the hope that the treatment will get better your health, and in a few time
Mhm.
it's very probably that your activity or your life return to the more normal possible. And don't worry, don't suffer anxious. It's a normal condition, and it's probably it's a period that you have the uh, you feel bad, but after that, I told you that your life will be better.
Okay.
I think.
Okay, Rina, that was good and complete as always. Thank you so much. Thank you so much, Rina. And remember, we will have the theoretical class tomorrow.
Yes.
And then the next day you will have at the same time the practical class, okay?
Okay, teacher.
Okay, thank you so much.
Thank you, teacher. I am sorry because I couldn't use the camera because I am in the car.
Worries. I understand, no worries. I have the same problem here, okay?
Okay, teacher.
Take care. Good evening or good night.
Thank you, teacher. You too.
Bye-bye.
Bye.
Thank you. Hello, Jocelyn. Good evening. Can you listen to me?
Hello, teacher. Good evening.
Good evening. Can you turn on your camera, please?
Okay, teacher.
Okay. I hope our connection won't fail, but if it's the camera, okay?
Okay.
Okay. I think I have problems. I don't know if you can listen to me well.
Yes, teacher.
Okay, let's try. Can you describe a psychiatric case you have encountered in your professional career, or in this case, in your rotations, maybe?
A un paciente psiquiátrico, teacher.
Yes.
Ok. Es que medio entrecortado lo escuché. Eh,
I will turn off my camera, okay?
if teacher.
I will
Okay.
turn off my camera. Yeah. Can you
Okay.
listen to me better now?
Yes, yes.
Okay. Go ahead, please.
Yeah. If I have a patient with obsessive compulsive would have obsessive with his why he did not want me to look or talk to anyone. If he did, he would start hitting him, pulling him, yelling at him.
Okay. That's the experience. It was your experience of one of your cases.
Yes, teacher, en el internado.
Okay, into the internship.
Inter-
Okay, go
yes,
ahead.
sí.
Oh, okay. Okay, Jocelyn, can you choose one condition and explain as if you were explaining to your patient?
Una condición de un paciente.
Yes.
De un paciente psiquiátrico, teacher.
You can choose any condition you want.
Could be diabetes.
It could be diabetes, yes.
Okay. At first, you will be told the diagnostic of diabetes that has been identified by the signs and symptoms that the patient presented. Management plan.
Can you repeat, please? Can you repeat the last part?
Teacher?
Can you repeat the last part? I didn't understand what you were
Okay,
saying.
okay. Okay. That that the patient present
Yeah.
uh, uh, then you will be given medication such as metformin or glibenclamide so that mm, s- so that you can take schedule an appointment for you control. It is mm, it is recommend that you avoid eating mm, eating carbohidratos, ¿cómo se decía, teacher?
Carbohydrates.
Carbo carbohydrate
Carbohydrates.
carbohydrates and walk 13 minutes a day. If the patient complies with the adequate medication, we would have a good prognosis. And if he does not comply, um, um, a bad prognosis.
Okay, prognosis. Carbohydrates.
Prognosis.
Okay.
Okay.
Can you repeat it again? Carbohydrates.
Teacher?
Can you repeat it again? Carbohydrates.
Carbohydrates.
Okay. Okay, Jocelyn, and now maybe you can talk about, remember the protocol we were talking about yesterday? Remember the steps? Do you remember the steps?
Los ¿no ve? Los 5 pasos, ¿no ve, teacher?
Yeah, but
By time.
please tell me in English.
Yes, teacher. Teacher?
Hello, I'm listening.
No muy bien, teacher.
I'm listening to you. Can you tell me the 5 steps or the protocol?
Los quiere que le explique los pasos, teacher?
Yes, please. Can you listen to me well?
Okay. No, teacher.
Okay, but you understand what I
Yeah,
was saying,
okay.
right?
Okay, teacher. The first diagnostic. The second management plan.
Okay.
The three
The third?
general advice for lifestyle changes. The prognosis teacher.
Yes, I'm listening.
The prognosis is the question time.
Okay. Can you explain to me one of them?
Teacher.
Can you explain to me one of them?
Teacher.
Hi, Jocelyn. Can you listen to me now?
No, teacher.
You cannot listen to
No, 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 teacher, entrecortado le escucho.
Okay, I think we're gonna have problems with our connection. I don't know if you can see my questionnaire too.
Teacher?
Can you see my questionnaire?
Yes, yes, teacher.
Can you fill it for me, please? I'm sorry about the
Okay.
connection. Okay, thank you, Jocelyn. And remember, please, tomorrow we will have the theoretical class at the same hour, 8 p.m. And the next day you will have the practical class at the same time of today. Okay?
Okay, teacher.
Okay, Jocelyn, thank you so much. See you tomorrow.
Okay, teacher. Goodbye, teacher. See you tomorrow.
Bye-bye. Hi, Weimar, good evening. Can you listen to me?
Yes, teacher.
Okay, Weimar. Do you have any experience with psychiatric patients?
Um, mm, mm, yes, teacher. Um,
Can you tell me about that?
mm, I have an experience with psychiatric patient um, had a diagnosis of schizophrenia.
Schizophrenia.
Schizophrenia, sí. The patient indicated that he had butterflies in his stomach.
Okay. I'm sorry. Okay, continue.
Um, eso, teacher, fue un
But he was on treatment. No.
In the treatment is ansiolíticos, teacher.
He was taking anxiolytics.
Yes, teacher.
Okay. Can you repeat, please?
No lo escuché muy bien, teacher.
Can you repeat? He was taking anxiolytics.
He was taking anxiolytic.
Okay. Okay, Weimar. Can you choose any condition you want and explain as if you were explaining to your patient the condition?
¿Algún ejemplo de alguna enfermedad? ¿Cómo puedo
You have
explicar?
you have to choose any condition you want and explain to your patient about the condition he or she has.
Teacher, podría ser hipertensión arterial.
Yes, but in English, please.
Teacher.
In English, please, Weimar.
The family is diagnosis of arterial it is that silently damages organs and the symptoms such as headache, nausea, dizziness appear. Right now, we are controlling his blood pressure with medication. They are on strict diet at home. Teacher?
Strict diet.
Sí, dieta. Sí, strict diet.
Yes.
At home, they have to control their diet, reduce salt, not smoke, exercise. At the moment, his prognosis is favorable. Favorable, quería decir, teacher. Favorable.
Okay. Favorable.
Favorable.
Okay.
Question time. Do you have questions? questions.
Okay, Weimar, that's good. Can
Estaba
you?
utilizando los 5 pasos, teacher.
Yes, I know, I understand, and that's good. And I want to please to choose another disease you want and explain these 5 steps.
Diabetes, teacher. Podría ser,
Okay.
o
You already chose diabetes or hypertension, was that right?
just
Oh,
teacher, hypertension.
okay.
Mm,
Diabetes is okay.
em, teacher, ¿le explico al familiar o al?
Yes, to the
o-
patient. To the patient and the family, you have to explain, please, with lay terms. Remember what is the lay terms?
Ok, teacher, con términos.
Yes, the patient can understand, okay?
Ok, teacher. She is with diabetes. It is a disease.
Disease.
It is
It is a disease because
disease
dizziness
or
is
disease or
when you
disease.
are.
It is a disease. It
Mhm.
is a disease.
You can say condition too.
Teacher.
You can say condition too.
Okay, teacher. It is a condition. Or a condition. Yes, teacher, sí, condition or disease. It is a condition. Damages the organs.
Damages
Vascular, teacher, ¿cómo se dice vascular?
the vascular organs, but say it
Vascular.
everything. It damages the vascular organs.
Vascular organs and the symptoms nausea, fever, diaphoresis, pollakiuria, asthenia, pérdida de peso, teacher, me olvidé que pérdida de peso.
Loss of weight.
Loss of weight. In the treatment, in insulina,
Insulin.
insulin, in the insulin subcutáneo, teacher, como lo subcutáneo.
Let me check. Okay, continue.
The insulin en subcutáneo. ¿Cómo dijo, teacher? Subcutáneo.
I'm checking. Just give me a second.
Give me a second.
No,
Sí,
give me a
¿cómo se dice,
second.
teacher? Perdón,
Dame un segundo. Subcutaneous.
subcutáneos.
Yeah.
Insulin en subcutáneos. At the moment, his prognosis is delicado, teacher.
Delicate.
Delicate. His prognosis delicate.
Prognosis.
Prognosis delicate.
Okay. Okay. Okay, that was good. It's better. Weimar, okay. Está mejorando poco a poco, está mejorando, pero estamos a hablar las frases correctas. Te das una idea, tú quieres expresarte, estás tratando, no es completo, porque difícilmente o sea, yo te puedo entender, ¿no? Más o menos lo que quieres decir, pero necesitamos practicar un poquito más, ¿ya?
Okay, teacher.
Okay. Just one more picture and I'll let you go. Thank you so much, Weimar. See you
Thank you, teacher.
tomorrow at theoretical classes at 8 p.m., okay?
Okay, teacher. Thank you. Goodbye.
Goodbye. Take care. Hi, Melanie. Good evening. You're muted. I'm sorry, I have my camera off,
Hi.
but my
Yes,
camera is not so good. Okay?
no problem.
Okay, thank you so much. And Melanie, I want to know if you have any experience with psychiatric cases or patients.
Psychiatric. I remember that my rotation was in the military hospital. I remember a funny fact that my doctor was a little strange because if you saw him, you think that he was a patient because the doctor in that area was a little messy and always told you things that you you don't understand. But I remember that in my rotation we have a lot of experience very interesting. For example, we have a patient that have schizophrenia. For example, he said that in his home he saw the evil I don't the anatomy of God. I don't remember how to say it. So, for example, he described that in his home he always hear bad ghosts and have a lot of hallucination. But in these cases, I remember a treatment, the electroshock, that was very interesting because I saw before see that treatment. I think that was maybe more aggressive, but not the electroshock. For example, use a little voltage. The patient doesn't feel a lot of pain. It's just the treatment was very fast, just minutes in second includes to be honest. The patient after the electroshock they rest just 5-10 minutes, I think. And depending of the cases, after the electroshock, the patient can be hospitalized by 1 day. I'm not sure, depending of the cases. And in that rotation, I remember that a lot of patients, for example, the patient that we can talk without security was the people that, for example, have a post trauma for because they work in the Brime, that was the rural zone. They usually work with the in with the terrorists and have a lot of brutal experience. So they describes the how see a lot of cows in that area. So for that reason they have problem to sleep. They don't eat very well. So for that reason they was in the hospital. And in the psychiatry rotation, I even the boss of that area was my personal doctor. I was I have the experience with she was the boss of the area. The doctor explained very good the cases. And well, I think that was the most important in the in that rotation.
Okay, yeah, that was interesting, Melanie. Thank you so much. Now, maybe you can choose any condition you want. It can be psychiatric or another one, and explain as if you were explaining to the patient.
Well, in for example, in the psychiatry, I remember, for example, the patient that have have the disorder of antisocial personality disorder. They, for
Mhm.
example, uh, doesn't they don't respect the laws. They usually are very uh, narcissism. They lie a lot. Um, so usually this kind of patient, for example, think that they don't need help. So uh, they are in the hospital just because maybe they have a lot of problems with the law, with the police. Maybe it's a treatment obligatory to don't go to the jail. So the I remember that this kind of patient, we have to talk a lot. The professional have to to try to be maybe very patient and maybe uh, confident. Have they have to try eh, que el paciente confíe en él. Try to the patient have confidence with the professional. And if I'm not wrong, I think that this kind of patient doesn't have a specific treatment. A lot of things that is very usually in this patient, they usually have, for example, problem with the drugs, or they are alcoholic, or maybe have other disorder, maybe depression or and others. So the treatment is the medication is most for the other disorder. And to the antisocial is very difficult to treatment. Is the psychotherapy is the most important kind of treatment in those cases. I remember that when in my first day in that rotation psychiatry, uh, I I feel like I maybe has very innocent because they uh, in the first in the first conversation they talk to you like a normal person. They even can cry and maybe demonstrate like they are the victims. And I remember that include I feel very sad for them, but not they lies a lot. When the doctor talk with us and tell us that they, for example, maybe are very violent with his or her family, I will be I was be very surprised and maybe in shock. So with this patient, we have to be very smart and carefully, and don't believe in all the that the patient said. We have to investigate a lot of the family history, for example, talk with their friends for source the truth, and look the better treatment or maybe the better psychotherapy to try this kind of people. And I think that the most important is try to this patient don't hurt other people in the society.
Okay, in the society.
The society.
Perfect. Okay, that's good, Melanie. Remember the protocol we used yesterday? We talked about these 5 or 4 steps. Do you remember?
A little, to be honest. I
Okay.
remember that we talked about the prognosis, the the diagnosis. In I think that the step 3 or 4 was the to talk with the patient about the lifestyle if it's necessary, and talk about the management plan, of course, about the medication and about the maybe the cares of the nurse. Yeah, and I remember that the last part, the step 5, was the question time to
Yeah.
talk with the patient, no? If we uh, maybe need tell more information about the case, or I think that a lot of patients, the most question is about how to recover about the illness, and if maybe what is the person of the mortality. No, that I think that the fear is the if the patient have the opportunity to recover or maybe not. So
Yeah.
I remember I don't remember
Yeah.
all, but
Yeah, that's good. Yeah, you told me about everything, not in that order, but it's good. Okay, and I want to know if you explain to your patients in order to know if they understood.
if I do it,
May-
or
Yes, maybe you ask questions if the patient understood everything, just to make
I
sure.
can. Okay,
Yeah.
so I can ask, for example, if have you maybe understand all the information, or maybe do you have some question, or do you understand all the process, all or maybe mm, have you maybe have you noticed that or maybe that if he have some some words to say it, or maybe include the patient. I think that a lot of time they need to just share the feeling, maybe they are with fear, or maybe they they just need to talk with someone. So maybe I can ask that.
Okay, okay, Melanie, thank you so much. That's good. It's good to know. I don't know if you can see my questionnaire.
Yes, Miss, I can see it. And then,
Fill it, please, for me.
Yeah.
And remember, tomorrow we will have the theoretical class as always. It's just the practice that you will give on Thursday, okay? Just one more.
Yes.
Okay. Okay, thank you so much, Melanie. See you tomorrow.
Thank you, Miss. Have a good night. Bye.
You too. Bye-bye. Hi, Sergio. Good evening.
Good evening, Mrs. Inas. Can you give me just 1 minute, please? My
Yes,
my
of course.
class from the diploma from my other course
Okay.
is about to
Worries.
finish right now.
Okay, no worries.
Thank you, thank you. Okay, Mrs. Inas, ready now. I'm sorry, my other course, like the class of my other course, was just finishing right now. So yes.
Okay, I understand. No worries, Sergio. Um, let's start. Maybe, I don't know if you have some cases of psychiatric patients that you have experienced.
Yes, I had actually the last patient I had with a psychiatric disorder was probably 5 weeks ago at Hospital San Juan de Dios. And she was diagnosed with severe depression. But apart from that, she wasn't oriented in space or person or time at by that time. And at the same time, she was like hyperactive, and
Mhm.
she couldn't like control her thoughts, her sayings, the way she behaved. Her condition was in a very unstable position emotionally. So yes, I mean he started medication with uh, psychiatric medication, right? And she also had malnutrition, like severe malnutrition. And well, explaining that most of what she was going through was because of her last relationship that affected her, like uh, in a very, very, very bad way. That it got to a point where her health, uh, her health was like in a very poor condition. So yes, that was like the patient I treated with, because she also was diagnosed with HIV, but treated mostly because of her psychiatric condition.
Okay, I understand. Such a poor woman.
Yes, it was like a very sad case because she's like very young now. But the good thing is that her health improved very much, and she's like in a better position right now. She's she's right now an outpatient,
Mhm.
and she's like right now at her home and living like a better life.
No, and she has the support of her family.
Yeah, she does have like a lot of support from her sisters, especially, and they take care of her. They're like always trying to help her with, for example, that relationship she had. Um, she lived like a lot by her own before. She was a realtor, but because of the problems she had with her health, she's now like staying with her family, with her sister that takes care now of her until she's like stable, like
Mhm.
to work and to live by her own.
Okay, I understand. Well, it's good to know that she's better now. Okay.
Yes, exactly, exactly.
Thank you, Sergio. And we have to choose a topic. Maybe you can choose a condition, any condition you want, and explain as if you were explaining to your patient.
Okay, but would I have to like explain to like as in a scenario or an example of how I would explain to the patient
Uh-huh.
what's his or her condition, or what
Yes.
exactly should I
Yes. Yes.
explain?
That's the thing. Imagine your patient has a condition, anyone you choose, and you have to explain to your patient about her or his condition.
Well, okay. Well, maybe I can use the example of this patient that has a depression, but I have to explain to her what exactly she just been diagnosed. For example, the HIV diagnosis.
Yes. Yes, you can.
Well, in the case of this woman, we prefer like not to tell her exactly what her diagnosis was. We explain everything like with detail to her family, but to her, we tried to tell her like the way I explained everything to her was that first of course I introduced myself as with my name, and that I'm like the doctor in treating her, and I told her that we were here like to help her improve her health, and we were not here to judge her about her personal life, and that we will be sure that she would be in great care, since she was going through a very hard time uh, by that moment, uh, and she couldn't control her thoughts. So I was trying to calm her with just being there present and telling her that I will be present there and making her like the different procedures, for example, an ECG, and I also offered her like the different tests that the project in which I work offers, and that everything involved in the project I work in would help her with her condition and what she had. Uh, I didn't like go into any much detail because she couldn't like really understand everything, or she wasn't like oriented
Mhm.
at the moment. But I tried to explain it to her like in a very simple way, if like focusing everything and based everything in making her that she had company and that we were like present there to help her.
Okay, that's good. And do you use lay terms?
Lay terms, like for example, like the ones in the last class, I guess, or which
Um,
ones exactly?
no, lay terms means that that you explained in easy words to your patient, so so she can understand you. So you use lay terms, right?
Yes, like most of the times, yes, because I mean, most of them don't get or understand like technical terms or medical terms, right? So yeah, we try to use like the simplest form to explain every patient about their condition, about or about the help we're trying to provide.
Okay, perfect. And do you remember I think you saw the yesterday's class?
Yes, I watched both of them. Yeah.
Okay. And do you have the chance, or do you remember what are the steps of the explanations?
Mm,
More or less.
but which of the explanation? I remember like the presentation. I remember like
Okay,
the thing that she.
the whole topic it was explanation, but you have like a protocol there, and where it was the diagnose, the management, the general advice, the prognosis, and final
Yes, I
questions.
guess
Remember
questions.
about that?
Yes. Yeah. I remember that, but probably the order of everything.
Mhm.
Probably I can't remember exactly the
Okay, no
order, but
problem.
yes, I remember. I remember the final thing was if the patient had any questions and the ideas of the patients also, right?
Yes, yes, okay. But I know you use constantly this protocol. I don't know if it's in order or no, but you usually use. So maybe you can choose any condition you want and try to explain these steps.
Okay, first it was the diagnosis, then it was what? Sorry.
I'm so sorry. Can you repeat it?
So first was explaining the diagnosis, right?
Yes, yes.
And after that diagnosis, what was the next
The
step?
manage
Sorry.
the management, then a general advice, the prognosis, and final questions or question time.
Okay. Okay, then. Um, well, with like depression and HIV diagnosis in a patient, probably I would first ask the patient if she's aware of what she was diagnosed the last couple of years, or if she knows or he knows that, if she has like some disease diagnosed in the last couple of months or years,
Mm-hmm.
so that I know how to communicate the problem. And probably I would tell the patient, if she knows or he knows what is exactly a sexually transmitted disease, and that she just being diagnosed with HIV with laboratory results, and after like asking the patient about his or her personal life, uh, I would tell her that, yeah, the recent tests we made on his or her are positive for, like in this case, HIV. We had like different confirmatory results, and the final result was positive. This doesn't mean that is like uh, this doesn't mean that she will pass away, or I wouldn't use die, but yeah, I would use like pass away. But because there's a treatment for this particular disease,
Mm-hmm.
uh, the way we're gonna manage the disease would be treating you, I mean, the patient, with a antiretroviral therapy. So the only thing we would need about you as a patient is your responsibility and discipline to just take a tablet once a day, and that will be it. We need your commitment. We will need only your commitment and responsibility and discipline to follow the instructions we are gonna make for you. Um,
Mm-hmm.
Talking about the prognosis, like I just explained, having this diagnosis doesn't mean a death note or something that will end your life, as long as you can uh, follow every instruction the doctor gives you about the change that there's gonna be in your lifestyle, and also with the treatment that you have to be very responsible with. Uh, I would ask finally the patient about if she or he has any questions about the treatment, about uh, the diagnosis, if it's a confirmatory result, um, if the patient has any idea about the the diagnosis or anything uh, he or she can express of how she feels right now that she or he knows the diagnosis, since it's like a very delicate thing to communicate to a patient. And I think I don't know if I missed like some step,
Oh,
but
that's good. That was really complete, and how hard to give a prognosis in this case. But you did it so well, I think. Okay,
thank you so much.
thank you. Sergio, don't worry, because I told you last class this will be we will have two scores, right? Will be I evaluated for two times the one you not assisted, okay?
Oh, okay, okay.
Okay, so no worries. I don't know if you can see my questionnaire.
Yes, I can see it right now.
Can you fill it for me, please?
Yes,
And
of course.
remember,
But
tomorrow we have classes. You will be able to come to our
yes,
class? Okay.
Yes, but first, Mrs. Inas, I don't know if I got it like correctly. I mean, is everything okay like with my grading or the practical classes I had, or do I miss any, or do I need any extra or something, or is everything
No.
okay?
No, it's not a problem. I just give you the chance to make this one class for the one you missed, and I put a license there, so it's not a problem for you. Okay, I know you're having a hard time with your other classes, and I know you are a responsible person. You came to almost the whole classes, so it's good. No worries.
Thank you so much, Mrs. Inas, and thank you for the help. And I'm
No
already
problem.
like here in Bolivia. I just arrived like last night, so everything like will work better from now
Okay,
on.
that's good.
Yeah,
Okay,
yeah. And,
really good.
and
Just
tomorrow, yeah,
mhm.
I'll be
Tell me, tell me.
in the class, like
Okay,
without
perfect.
any.
Okay, that will be perfect. Remember from for the theoretical classes, we will have from 8 to 9. Then
eh,
you don't have to stay because other people will stay, and the next day you will be at 10. Is it good for you again?
Yes, perfect. So tomorrow I'll have just my class from 8 to 9,
Mm-hmm.
and on Thursday I will have my practical class at 10 p.m. Right?
Yes. Okay.
Perfect. Then yeah,
Okay.
it works for
And
me.
okay, that's good. Remember to make your or do your practices, please. And I think Thursday will be our last class, and on Monday we have the final. Okay?
Oh, okay. The final exam
Yes,
on Monday.
on Monday. Uh-huh.
And the homework we have is like due Sunday. Do you like we
Yes,
have
I
until Sunday
Sunday.
to have it done? Okay,
Yes,
perfect.
please. Okay. Thank you so much. Have a great night and see you tomorrow.
Thank you, Mrs. Ina. You too, and see you tomorrow.
Okay, take care. Bye bye.
Bye.